else do you do that's a little bit weird, my sweet chickadee? So my name is Elizabeth, also known as Nurse Zabe, here on YouTube and Instagram, as well as TikTok if you want to follow me over there. And I'm a labor and delivery nurse, certified childbirth educator, and mom to 3. And today I wanted to come at you guys with a video all about some of the 10 crazy wacky facts that nobody tells you about newborns, because while these are like mini humans, they're super weird mini humans. And so I recently had a patient tell me, so you guys just let us take this baby home? That seems a little ridiculous. I want to give you guys some 10 facts that if you see with your new baby, to not be freaked out or scared of at all, because we want to know that these, while weird, are totally normal as these guys are transitioning to extrauterine life. So let's go ahead and jump into things. So I'm splitting this video up into a few different categories. I want to talk about what babies are first going to look like right after birth, what are some weird hormonal things that we might see your baby doing, what are some things we might see them doing with their feedings, and etc, etc. So first off, when your sweet little pumpkin is born, oh my gosh, so cute, right? You're gonna think your baby is the most beautiful thing in the world, and I think that your baby is the most beautiful thing in the world. But conventional beauty standards might tell us that these things look a little bit more like aliens. That's because they were perfectly designed to fit through your pelvis, but sometimes that means we gotta do a little bit of rearranging. So your sweet little babies are born with these beautiful noggins that have soft spots and sutures, which is different plates of bones, basically. So that these bones and these soft spots can change position and mold to fit through your pelvis. And particularly with your first baby, who is going to kind of forge the path through, their molding, their little head shape is gonna be a little bit different than what we would expect to see with a perfectly round little noggin. The good news is it typically goes back and gets much rounder within the first few days of life. Even in the first few hours, there is a big change or difference. But know that if your baby comes out looking like an alien, that's totally normal. The other thing I want you to know, when you are pushing, this is what we're gonna see in the baby's head. And a lot of times there might be some molding or even a little bit of caput where there's a little bit of swelling here. So it's gonna look like this is the whole size of your baby's head when you're crowning. You might not see this. Your support person might see it and think, oh my gosh, nobody's saying anything, but my baby has an abnormally small head. But don't worry, that head is gonna keep coming and it'll come out and be maybe a little bit misshapen, but a perfectly average and normal size head. No need to worry or stress about that. The other thing that we often see when babies are first born and put up on your chest is that they might be not totally pink yet, and even as they're pinking up, their hands and feet are going to probably remain in more of a bluish hue. This is something called acrocyanosis, and this is another thing that is totally normal in the first few days of life. When your baby is born, their entire circulatory system is going to change. The entire thing. They're using lungs now to breathe that they were never doing in your belly. And so with that change, they're going to be really focusing, oxygenating their central areas, and their hands and feet may be purple, and that's because they're getting a little bit less oxygen, and that's totally fine and a normal finding. When we are looking at your baby, if their face is nice and pink, if around their lips is nice and pink, that is what we are looking for. Sometimes if you've had a really fast labor, or you've pushed for a really long time, we might even see a little bit of bruising on your baby's face, or some broken blood vessels in their eye. Those can all be a super normal part of birth. And one of the reasons why we know that these babies are very resilient is because they can make it through a birth like that and come out the other side still living their best lives. So also when your baby comes out, some things that you might notice about them is that they are covered in a cheesy substance, and they might have a little bit of hair on their upper back, shoulders, on their face as well. So the cheesy substance is called vernix. It is literally the world's best moisturizer. We don't want to mess with that because that's what kept their skin nice and hydrated when they were in your belly. We just want to kind of rub that in. The hair is called lanugo, and that was to keep them warm when they were in your belly. So the more pregnant you are, the further gestational age you are, typically we see less lanugo and we see less vernix because those things have been absorbed or have fallen off in the case of the lanugo as the baby is getting bigger and healthier and fattier and doesn't need those things quite as much. Another thing that you might notice, if your baby is born really, really quickly, if you have a really long pushing time, or if your baby's born via cesarean birth and they don't get that really tight squeeze on the way out, sometimes they will swallow a little bit of extra amniotic fluid. And what that can do is it sits on their belly and it can really irritate their belly. And so they might be really, really spitty. They might also be passing a lot of meconium in that first 24 hours of life. And so by spitty, what I mean is that they are spitting up. They're kind of gagging and spitting up amniotic fluid. Sometimes it's just clear. Sometimes it's even tinted with a little bit of brownish discharge. That's old blood from you. All of those things are totally fine. What we want to do to help these babies if they are spitting up is either sit them up, pat their back, or even roll them to their side and pat their back. These little guys are kind of made for that easily sometimes to come up and go right back down, and that's totally fine. Sometimes it comes up and stays out. Sometimes when they're spitting up though, they hold their breath, and you definitely want to call out for a nurse or provider if that is the case going on. Also, as you're helping them clear their secretions, you can use a bulb syringe, decompress that, put that in baby's mouth, and suck out any secretions that are in there. That is something that we often see in those first 24 hours. And also sometimes why babies might be less hungry in those first 24 hours as well. So often right after birth, they do a really good feed and then they get pretty sleepy. This is nature's way of letting you guys both get some rest, but also keep in mind that their tummy is about the size of a marble. It's itty bitty. Itty bitty tummy. And that itty bitty tummy might be full of amniotic fluid. So they've got to work that out by either spitting up, pooping it out so that they can make room in their tummy for more food. Because they have such small tummies and they're passing these massive poos, it's not surprising that our babies lose weight in the first few days after life until your milk comes in. Even formula-fed babies are going to be losing weight. And so what we are going to be looking at is the percentage of overall weight loss. We worry if they're losing more than 10% of their birth weight that maybe they're not getting enough in. The other thing we can look at is pees and poop. That's a whole nother story, but if nobody has showed you a meconium diaper yet, I'm gonna insert one of those right there. Meconium is your baby's first poop. They're gonna be doing that for the first few days of life until they start digesting formula or breast milk. And it is sticky, tarry, and it's been sitting in their little rectum for about like 6 months since they had a rectum, which is super wild. Just kind of gathering up until it can come out and grace us with its presence. Sometimes your baby's even on the way out with that nice tight squeeze will pass some terminal meconium. The other day, my patient was delivering her baby. The baby kind of came out and a big old turd came out behind it and got all over the floor. It was super messy and sticky. So sometimes that happens during birth and that can be another normal thing that we see. What else do you do that's a little bit weird, my sweet chickadee? Another thing that can be a result of that excess amniotic fluid can sometimes get in their little nasal airways and cause sneezing. Sneezing can be a really normal thing for babies to do in the first few days of life and is not indicative typically of a more sinister sickness or infection or anything like that. But of course, if you're worried about your baby being sick, even if you just think it's a common cold, it's great to touch base with your provider because a common cold for us, RSV is a common cold for us, can be really, really significant for babies because their immune system, they're still working on developing it. The good news is simply by being born, they are gathering good bacteria to help. Okay, I want to talk hormonally what we can see with these little peanuts because it is pretty odd. I'll just say it, it's pretty odd. So hormonally, there's a few things that we can see as your baby is withdrawing from your hormones. If you're having a little baby girl, often we will see a little bit of vaginal discharge, a creamy milky white discharge is totally normal. Sometimes that even can be a little bit blood tinged. That's called pseudomenses, and that is another normal finding that we see as your baby is withdrawing from your hormones. The other thing that we can see in both genders of babies is witch's milk. And witch's milk is basically your little baby's breast buds get swollen, and if we were to express, which we don't want to do, we'd actually be able to express a little bit of breast milk because they are, again, withdrawing from your hormones. Another thing that happens hormonally is that we often will see swollen testicles and swollen labia that are not at all what we would expect to see on a baby. But these things typically go back to normal within the first few weeks to months of life as the hormone shifts occur. The other thing that I think a lot of people don't quite know about when they go in to have a baby is how completely wild and unpredictable that second night of life can be. I call it the second night fright. And what happens during the second night fright is that your baby is now fully awake. They've had their nice little snoozing in the first 24 hours, and they are feeling gassy. They are feeling uncomfortable. They are feeling hungry. They realize sucking is amazing. Breastfeeding is fabulous. They want your milk to come in. They also are now realizing, hey, I'm no longer inside of my favorite person, so I want to be on top of my favorite person at all times. What's really normal? Second night of life, cluster feeding, only being calmed by the breast, constantly wanting to do skin to skin. You might feel like at the second night of life, oh my gosh, I have no milk, my baby is not getting anything that they need. And for most of the people, this is not the case. So I don't want you to be discouraged by the second night fright. I want you to use your first 24 hours to get as much sleep as you can, right? We're gonna be offering the breast every 3 hours or so. But if your baby's not interested, prepare yourself, because they will be interested soon. And of course, making sure that we are achieving a nice wide latch, not having nipple pain with latching is all gonna help us get through that cluster feeding that can feel really intense. The good news is your milk comes in between day 3 and day 5 typically. So once that milk comes in, I feel like that's when you get the true personality of your baby, because that second night fright is simply frightful. Make a plan with your nurse, make a plan with your partner on how you can maximize getting at least a little bit of sleep so that you're not up for a full 24 hours with that second night of life. Now, the last thing that I want to talk about is something that I see super frequently. Always have somebody calling out asking about this. And of course, if you see it on your baby, call out and ask about it, because we want to make sure that this is what we're talking about, but it is newborn rash. So this is a rash that we see often in babies in their first couple of days of life, and it almost looks like little bug bites, a little red irritated bump that can appear anywhere on baby. Often we see it on the trunk, limbs, face, your whole baby basically. And this is just baby getting used to the outside world. They are gone through a really big shift of being in this nice little sterile environment. Now they're out in the outside world with all sorts of different things. So newborn rash is not something that typically bothers baby. It's not irritating to them. So I know that sometimes it can look irritating to you, but it's not to them. The flip side of this is something called newborn acne, which we typically see in week 2 and week 4. And this is actually, again, withdrawing from your hormones. And so we see these more on baby boys than on baby girls because of that withdrawal of hormones. The best thing to put on any rash that you're seeing after checking with your provider is a little bit of breast milk if you've got it. Much like the father in my big fat Greek wedding, putting Windex on everything, I would vote breast milk, colostrum on everything is definitely this cure-all for skin conditions. Okay, so did you learn anything about a baby? Let me know. Did your baby do any of these weird, wacky things? Certainly let me know. And if you have any questions or anything further that you'd like to share, definitely do so in the comments. Thank you guys so much for watching. Bye guys.